A clot occurs when blood, which is usually liquid and flowing, thickens, becomes more gelatinous, and forms a clump. This is useful to halt excessive bleeding when you have an injury. But some blood clots can be harmful and even life-threatening. What is a blood clot? Blood clots normally form after an injury to protect your body from losing too much blood. But they can also form in an artery or vein even if there is no obvious injury. Complications can occur if it doesn't dissolve naturally or if you don't get treatment. The signs and symptoms of a blood clot differ depending on where it is, in the heart, brain, arm, leg, lung, or abdomen. Some of these symptoms are common in other health issues, so always consult with your doctor. And keep in mind that it's not uncommon for clots to cause no symptoms at all. Here are some silent signs and symptoms of blood clots to watch out for. Leg cramps. People who have experienced a blood clot in the legs say they felt cramps or pain similar to a Charlie horse. A blood clot that forms in a major vein, often in the lower limbs, is called a deep vein thrombosis, DVT, and it can cause leg aches, pain, and cramping. The clots can develop slowly or appear suddenly, specifically after a prolonged time in a sitting or cramped position, like on a long-distance flight. Ignoring a blood clot in the leg for even a day can end up in a pulmonary embolism, which is much more dangerous, according to Christine Arthur, MD, an internist at Orange Coast Memorial Medical Center in Fountain Valley, California. A pulmonary embolism can occur if a portion of the clot in the legs breaks off and travels to the lungs. About 1 in 3 people with DVT will have a pulmonary embolism, which is a potentially life-threatening medical emergency. Sitting for a while? You might want to give compression socks a go. Back pain. Back pain might not seem like one of the likely blood clot symptoms, but it can be an indication that a blood clot is present in the pelvic area or in the inferior vena cava, which is the major abdominal vein. According to the American College of Cardiology, 2.624% of people with DVT have inferior vena cava thrombosis. Although blood clot-related back pain seems to be one of the more rare symptoms, these types of clots can result in permanent damage if not treated, as they cut off blood to the extremities. If you experience this along with other blood clot symptoms, contact your doctor. Although blood clots can cause back pain, the most common causes of low back pain aren't typically blood clots. Discolored skin. A blood clot disrupts normal blood flow, and it can result in discolored skin. If an area of one leg appears to be red or has a different color in any way, a blood clot is one possible cause. This symptom should be checked by your doctor, according to the Centers for Disease Control and Prevention, CDC. You could still be at risk for a blood clot even if you exercise regularly. Skin is warm to the touch. Another common blood clot symptom is a variation in temperature where the clot is suspected. Much like the discoloration, this is caused by a disruption of blood flow. If this temperature variation continues and you have a history of increased risk of blood clots, call your doctor. Usually these 3 symptoms appear together: warm skin, leg cramps, and discolored skin. Swelling. Swelling in the arm, hand, foot, ankle, or leg is one of the most common signs of a blood clot, according to the CDC. Blood clots are only one of the reasons why a body part may suddenly feel swollen. 9 weird reasons your body suddenly feels swollen. Face, feet, or even tongue suddenly swollen. Experts share why this happens, what you can do, and when you should worry. You're eating artificial sweeteners. Enjoy the sweet stuff in those pink, yellow, or blue packets. That could be what causes swelling, says Karen Bentley, author of the Sugar-Free Miracleism Diet Handbook, who resides in the greater Boston area. She points to a study in the Clinical Journal of the American Society of Nephrology, which pulled data from the Nurses' Health Study, involving over 3,300 women, and showed that 2 or more servings of diet soda, which contain artificial sweeteners, a day could lead to up to a 30% decrease in kidney function. When kidney function is compromised, there's less fluid in blood vessels, she explains. The result, you're prone to body swelling. Your best bet, according to Bentley, is to refrain from eating or drinking items that contain saccharin, aspartame, or sucralose. Diet soda can also slow your metabolism. You're insulin resistant. Bentley explains that if you have insulin resistance, which is commonly linked with type 2 diabetes, you may experience body swelling. In her book Suicide by Sugar, sugar expert Nancy Appleton, PhD, explains that insulin resistance causes the body to retain sodium. Bentley says, "This causes the body to retain more fluid and swell," she adds. If you have insulin resistance, now's the time to get into a good exercise routine. Maintain healthy blood pressure, lower stress, and get the sleep you need, advises the Centers for Disease Control and Prevention, CDC. Here are 13 natural remedies for gout pain and swelling. You're cleaning your face all wrong. An improper skincare routine could be what causes swelling in your face, says Jonathan Cantor, MD, medical director at the Florida Center for Dermatology in Augustine, FL. Sometimes, swelling on the face can be caused by being too rough on the skin, whether from using a loofah, harsh cleansers, or astringents, he says. In these cases, less is more. Dr. Cantor suggests using a very gentle facial cleanser, washing with your hands, no washcloth or scrubbing device, and maintaining a hands-off, do not pick policy. You're going heavy on the salt. Overdid it on the Chinese food over the weekend. Dr. Cantor says indulging in too much salt and MSG, both of which are very common in processed and commercially prepared foods, can cause body swelling. Regardless of swelling, it's smart to cut back on foods with a high salt and MSG content. Per the American Heart Association, AHA, the organization suggests that adults have no more than 2,300 milligrams (mgs) of sodium daily. Ideally, they recommend 1,500 milligrams per day as a good limit. Go easy on prepackaged and processed foods which are laden with sodium, per the AHA. Don't miss these 9 daily habits that could help you reduce bloating. You ignore dental issues. Don't put off that dentist appointment. Lower face swelling, particularly when it's on one side, can be caused by dental abscesses. So never let a cavity go untreated. Dr. Cantor says, your visits to the dentist aren't just about cleanings and x-rays. Dental experts often check for a host of health issues, ranging from problems that can cause your face to swell to serious conditions like oral cancer. Your shoes and gloves are too snug. Sometimes, swelling is an emergency symptom. Swelling, along with fatigue and shortness of breath, can be indicative of heart failure, says Michael Miller, MD, professor of medicine at the University of Maryland School of Medicine in Baltimore and the author of Heal Your Heart. However, he also says there are plenty of other explanations for what causes swelling. Perhaps the most common cause of foot, ankle, and hand swelling outside of injury is wearing shoes, socks, or gloves that are too tight due to constriction of blood flow. You've been on your feet for long periods of time, standing in line for hours waiting for must-have concert tickets or walking around more than usual. Don't be surprised if you notice some leg swelling. Dr. Miller says that this can happen when you stand for hours on end and may be exacerbated by vein weakness, venous incompetence, and varicose veins. Fluid buildup in the legs can also be caused by inactivity or being overweight, says the Mayo Clinic. Here are the 10 signs of disease that your feet can predict. You take common pain relievers or medications. Ibuprofen and other non-steroidal anti-inflammatory drugs, NSAIDs, can lead to swelling brought on by fluid retention, says Dr. Miller. He adds that medications designed to treat high blood pressure, amlodipine, and diabetes, pioglitazone, can also contribute to fluid retention-related swelling. The same goes for antidepressants. Check with your doctor to see if any medications you're taking could be contributing to swelling. The swelling is something more serious. Sometimes your swelling may be an indication of something more serious. A red flag symptom is one-sided swelling. Swelling in a single extremity, in which trauma is not a factor, could be a sign of a skin infection or even a blood clot, says Dr. Miller. Swelling in one leg could indicate prostate cancer. Swelling in that instance often occurs when there's a lymphatic blockage, he says. It could also be caused by DVT, deep vein thrombosis, which is a medical emergency. Excessive sweating. When paired with other symptoms, excessive sweating can be one of the blood clot symptoms you shouldn't ignore, located in either the lung or heart. These are very serious types of blood clots that should be treated immediately as a medical emergency. Shortness of breath. A pulmonary embolism, when a blood clot blocks a vessel in the lung, can cause symptoms like shortness of breath, difficulty breathing, and chest pain. Another lesser-known symptom of a blood clot in the lungs is back pain. In some cases, people with a pulmonary embolism may have a drop in blood pressure and pass out, or they may even cough up blood. These symptoms are a medical emergency, but any clot symptoms should be taken seriously and investigated by your doctor. In addition to prolonged sitting, other risk factors for DVT and clot formation are injuries, including fractures and major surgery, chronic conditions, like heart and lung disease, confinement to a bed, pregnancy, and hormone use, such as birth control pills. If you enjoyed this video, don't forget to give it a thumbs up and subscribe to our channel.